There's a bottle in your bathroom right now, silently raising your blood pressure. Stop using it for 3 days and your numbers start dropping. A 2015 paper in the American Journal of Hypertension showed that in treated hypertensives, 3 days of antibacterial mouthwash pushed systolic pressure up by over 2 points. The mechanism trail behind it goes back further. Nobody talks about it. The bottle is mouthwash. Antibacterial mouthwash, Listerine, Crest Pro Health, the blue stuff, the amber stuff, the one your dentist handed you a sample of after your cleaning. It works the way it advertises. It kills bacteria in your mouth. The problem is that one specific group of bacteria living on the back of your tongue is the gateway to your blood pressure system. Here's the chain. The leafy greens you eat, the arugula, the spinach, the beetroot, they contain dietary-nitrate. Your body can't use that nitrate directly. The bacteria on the back of your tongue do the conversion. They turn nitrate into nitrite. Your gut then turns nitrite into nitric oxide. Nitric oxide is the molecule that relaxes the smooth muscle in your arteries. It's the same pathway nitroglycerin pills work through, the same pathway Viagra works through. Without the tongue bacteria, the whole chain breaks. So what happens when you swish antibacterial mouthwash twice a day? You sterilize the very bacteria your body needs to make nitric oxide. The 2013 paper from Kapil and colleagues in Free Radical Biology and Medicine ran the controlled experiment. 19 healthy adults, 7 days of chlorhexidine mouthwash. Oral nitrite production fell 90%. Plasma nitrite fell 25%. Systolic and diastolic blood pressure both rose between 2 and 3.5 points. The effect showed up inside 24 hours and locked in over the week. 3 points might sound small, but here's the part that gets ugly. Joshipura's team in Puerto Rico ran a cohort study, 540 adults, 3-year follow-up. People who used over-the-counter mouthwash twice a day or more had over double the rate of new-onset hypertension compared to non-users. A separate Joshipura cohort, 945 overweight adults, tracked the same twice-daily group and found a 55% higher rate of new prediabetes or diabetes within 3 years. Same mechanism, less nitric oxide, less insulin signaling, less vascular health. Now here's what should make every gym person in the comments uncomfortable. There's a 2019 paper out of Plymouth, 23 healthy adults. They ran on a treadmill for 30 minutes. Normally, after a hard run, your blood pressure drops for a couple of hours. It's one of the main reasons exercise lowers cardiovascular risk over the long run. The researchers had subjects rinse with mouthwash after the run. The post-exercise blood pressure drop was blunted by 61% at the 1-hour mark. By 2 hours, the drop was completely gone. Sit with that. Your workout is partly working through the same tongue bacteria your mouthwash is killing. You're exercising hard, then sterilizing the molecule that delivers half of the cardiovascular reward. The fix is free, and it works faster than you would expect.
Stop using antibacterial mouthwash. That's the first move. Listerine, Crest Pro Health, anything with the word antibacterial or antiseptic on the front. Drop it. The 2019 Tribble paper showed that within 3 days of stopping a chlorhexidine rinse, systolic blood pressure actually dropped 1.5 points below baseline as the nitrate-reducing bacteria recolonized the tongue. 3 days, not 3 months. But there's one critical exception you need to hear. Chlorhexidine is prescribed by dentists to treat active gum disease. If your dentist gave you a specific chlorhexidine rinse for periodontitis or after oral surgery, don't stop on a YouTube video's word. Call them first. The benefit for an active infection can outweigh the blood pressure cost. This conversation is about the over-the-counter daily habit, not the prescription. Talk to your dentist before you change anything they prescribed. Now here is the second move, and this is where the numbers actually shift. You feed the bacteria that make your nitric oxide.
The 2008 hypertension paper from Webb's team gave volunteers 500 milliliters of beetroot juice. Their systolic blood pressure dropped 10 points. Diastolic dropped 8. Peak effect at 3 hours. The blood pressure benefit persisted 24 hours later. When the same subjects rinsed and spit before drinking the beetroot juice, the effect disappeared completely. Strong evidence that the entire pathway routes through the tongue. You don't have to drink beetroot juice. The 2013 meta-analysis in the Journal of Nutrition pooled 16 trials. The pattern was consistent. Dietary-nitrate, the kind you get from arugula, spinach, Swiss chard, kale, rocket, dropped systolic pressure an average of 4.4 points. Add a beet salad twice a week, the number climbs higher. This is the food the longevity researchers tell their own families to eat. Cheap, no prescription. The mechanism is the same as a nitric oxide pill, except the pill is built by the bacteria you already have in your mouth. Third move, tongue care done right. Brush the tongue with a soft toothbrush once a day. Skip the metal scraper if you tend to overdo it. The 2019 Frontiers paper found that frequent aggressive tongue cleaning correlated with blunted nitrate-reducing capacity. You want a clean tongue, not a sterile one. Same idea as the gut. Friendly bacteria aren't your enemy. Quick note on the strength of all this. The mouthwash effect alone, 2 to 3 points, isn't a hypertension treatment. Real medication can drop you 10 to 15. But 2 points compounds with everything else you're doing. 2 points on top of exercise, 2 points on top of weight loss, 2 points on top of sleep, 2 points on top of the magnesium and the cortisol work. Every multiplier matters when you're trying to stack them. If this helped, check out our video on the natural cortisol drop in days, where we cover the other free lever almost nobody uses. The link is in the description below. This is research, not medical advice. Talk to your doctor and your dentist before changing anything.